Now I don't see the yes. Okay.
Yeah.
So should we start or we wait still?
Yeah, we may start, but some people, they want to, we can give the link. Do you think so?
Hello.
Yeah.
Can anybody hear me? Just to let you know. Hi, Lily. It's Trish. I'm online as well. I don't think my camera is on, but I'm online.
Okay, so if anybody was bothered about their confidential, you don't want to be showing on the video, and you can close your video. But if you don't mind, just open. It doesn't matter. Okay. Yeah, I just showing, just tell, because some people may thinking they're confidential, and so this video will be shared to some people because it's an open video, open lecture. So that we will be try to we will tell people what is medical Qigong, and will be shared publicly. Okay.
So
and
yeah, I think that it's important because I don't mind that my face is recorded in the camera, but anyone who wants to ask any questions later on, and they don't want their face to be seen in YouTube, and they could just simply shut down their videos or their cameras. Because I have had some problems before that some attendees, they don't want to be shown in YouTube. So we'll make it maybe at the beginning this clear. And Lily, would you also maybe mute the attendees, because I could hear some backgrounds, some noises in the background.
Oh dear, I don't know how to do that. If anybody can tell me.
Or I think that everyone maybe could just mute their themselves, so that we don't have any noises in the background.
Let me see if I can.
If
I can mute it.
If you put your link on the participant, I think, then you could mute everyone's, right?
Yeah, okay, but what seems I can't mute them. Wait, okay. Okay.
Now I see that everyone is actually mute except you and I, so that's fine.
Oh, that's fine. Okay, yes.
So I will start now and you will record, okay?
Yeah, I already recorded. Okay.
All right, so let me just from the...
Oh, Martin is okay. Yes, I know.
Okay, so...
Yeah.
All right.
Okay, thank you. And welcome my teacher, Huating, to give us this lecture. She's very, very busy. She just takes this time to want to told us what is medical Qigong. I always tell my client about it. So I learning this from Dr. Lee, and today he give us this lecture and just tell us how give a roughly picture, and then to see if you want to learn in the future. Come, Teacher Lee. Thank you.
Okay.
Please.
So,
yeah.
So thank you, Lily, for your introduction. I'm very glad to see you in Zoom tonight. I'm Huating, so you can call me Huating. I'm working as a TCM practitioner like Lily, and I'm working with acupuncture, with herbal teas and medical Qigong. So I have quite good experience like working with my patients, teaching them medical Qigong, so it makes the acupuncture treatment more effectively. And it's also very good support for the patient themselves. And I'm very happy to share some of my experience or share my point of view with you this evening. And I'm very glad that later on, maybe we could have some exchanges and you could ask me any questions that you have. All right, so before we start to talk about Qigong or medical Qigong, you might wonder what is Qi. You all might have heard yin and yang from Lily to talk about Qi deficiency in your treatment, but what actually is Qi? This is a quite important concept in the Chinese medicine. I always tell my patient that there are two parts in our body or regarding our health. One part is visible, that we could all see. We could do blood tests and we could see our muscles. We could check our bones. We could check our livers, our kidneys, all the organs. So this visible part, it's provable scientifically. It could be researched on. But there are quite a big part, what I call the invisible part, that is very often ignored in the conventional medicine. For example, we call the energy or the meridians, the emotions. We all know that if we are emotional, if we are angry, that it will impact our heart rate, it will impact our blood pressure. And if we are very sad, it will also impact our sleep or the part that we can see. So if we are stressed, we know that we won't sleep well and we won't feel well. And even the muscles tend to be more in tension. So all these parts that are invisible, they had a very direct influence on the visible part. And what if we call the Qi? Qi is not visible. It could feel. We could all feel if, for example, that my patient tell me, oh, I don't have any energy today. I'm very tired. And at the end of the day, I'm completely depleted. So this is actually invisible, but we all feel it in our everyday life. And in the TCM, we had even more classifications in terms of what Qi is. Qi is energy, and Qi had different forms. There are defensive Qi. There is this nutritive Qi who nourish our body, who nourish our skin, or our part that are visible. And there are also two major forms. One form is what we call energy Qi, and the other form what we call our body fluids, like the water, more the fluid part. So if we are talking about all the visible part, they could become sick, or we can check the problems. The invisible part, like our Qi, our energy, our emotions, they could also become ills. And if I'll move to the next one. So you can see this is a picture showing like the development of this Chinese character, what Qi is. In like more than even 3,000 years ago, there is already this gas form showing the picture what Qi is. It's a gas form, and it's like, for example, even in a car, we can also say it's from the gas. Gas in our body, it's what the Qi is. And if the category Qi is in the invisible part, and what has the function? Qi has many different functions. So one function is Qi move, Qi make us feel good. The energy when it's moving, when it's really moving freely, then we feel ourselves happy. We feel that our body, it's in a flow. We don't have much pain. And Qi also keep us warm. If we had warm hands, warm feet, and we don't really freeze very easily if we had a good Qi in the body. And we also say this defensive Qi, if it's good enough, then we don't get sick easily. Qi function is a very important part of our immunity. So if we don't have enough Qi, we might also become sick very easily. Qi also has the function to transform the different food, to transform the airs that we are taking in. It's also transformation of the different process in the body, the medication that we are taking in, that our body will try to detoxify. This is all the transformation processes. There are also many holding function that Qi is doing. For example, people have their organs holding in the proper place, that our uterine or our stomach, they are on the proper position instead of dropping down. This is also from the Qi function. So what if the Qi doesn't really function well? What we call Qi could become ill. And at this stage, very often that the conventional medicine, they don't really find anything. I have many patients coming to see me. They have checked many things. They already have their blood test, a big blood test, all the organs, and they also had MRT. They also have also their heart monitoring, and the doctors do not find anything actually in them, and telling that they are very healthy, but still they have many complaints. So one of the complaints they're talking about, that they could feel the pain, they feel a lot of pressure. So what is this? This is what we call, for example, Qi stagnation. When Qi stagnates, very often there could not be found in the blood or in the organ check, but the patient tell a lot of symptoms, like they have the pressure in their head, or they have pressure in their chest, and they also have the congestion feelings, for example, congesting feeling in their in their throats. They feel that something is blocking their throat or blocking their stomach, but still the doctors couldn't find anything. And sometimes they also have a lot of headaches, like the migraines when the weather changes, or when they're before their periods, when they don't sleep well, they will have a lot of headache. And these headaches are due to the Qi stagnation in the TCM. So Qi could stagnate, and Qi could also be deficient. So what if Qi is not enough? If we don't have enough energy, we could feel very often that we are tired. We are tired maybe after a few hours of getting up, and a lot of patients, they even feel very tired the first thing in the morning. I have many patients telling me that they sleep all night through. After 10 hours sleep, they could still sleep longer. They're not feeling refreshed. This fatigue is even the first thing they feel in the morning. And these people, these Qi weakness people, they always also have cold hands, cold feet. They wear even more clothes than other people. And very often, if they are sitting in their office for a few hours, that they will completely have ice cold hands and feet. Some patients will even tell me that even at night they have to really put on very thick wood socks, because their feet are so cold that they couldn't sleep well. So this is what we call the Qi weakness. And Qi could also move in the wrong direction. So if our energies doesn't really move smoothly in the proper direction, then we will feel it, for example, as high blood pressure, that the Qi goes up to our head. And in a very dangerous situation, the Qi could also provokes strokes. Many people will complain that they have tinnitus or the ringing in their ears. This is also another example that qi moves in the wrong direction instead of going down properly. That very often that the qi, they goes up to the head, and they should not actually. And another very often complaint in the practice is nausea. People feel that they want to throw up, but actually they didn't even eat anything yet. And another very often now in the COVID time that patient will complain that they cough. So the cough after some infections or even some dry cough without infections, this is also an indication that qi moves in the wrong direction. So if we say qi could be stagnated, qi could be deficient, qi could move in the wrong direction, and qi could also not having this function of holding our organs properly. So if qi is sinking, well, we will have a lot of like organ sinking problems, for example, like stomach sinking, kidney sinking, or uterus prolapse. All the prolapse, they are showing that the qi is not holding the organs properly. And at this point, so we talk all this qi disease. In this stage, the doctors, they still really don't find anything yet, or this disease, they accompany with some other disease that might be checked. For example, people that already have some liver problems, but the complaint that they have might not be explained by the test, by the medical result that they have. And even people who take medications, they could still suffer a lot from this qi disease, because if we don't address the problem with the qi, we won't really have a good feeling, or we won't feel well in our daily part, because this invisible part is not functioning well and is not addressed accordingly. So to address these causative factors of qi disease, we have also to look at why we actually develop the qi diseases. There are many reasons. In TCM, we say one important reason, for example, is our emotions, angers or stress, sadness, like shock. Many nowadays, many factors contribute to the emotional disbalances, because we are working quite hard. We have stressful boss, we have stressful work colleagues, and long hours of working, and even now working in home office with the partners, with the families, etc. So emotions are very important to cause the qi dysfunction. And the diet as well, maybe you already hear it from Lily. In the TCM, we recommend really to eat cooked food, to eat warm food. So if you eat too much raw food, too much cold food, the food directly out of the fridge, or irregular diets, too much sugar, too much dairy product, too much fat, all this contribute to the causes that develop this qi disease. And there are also one important factor, what we call the external pathogens. So namely, the infections, the virus, or the bacterial infections, what we categorize it under external pathogens, because in TCM, we say that even the winds, the cold, the dampness, all these factors, they could make us sick. And overwork, including that people working very late. Some people may work even at night, they work till 11, till 12, And if they work during the day, they don't take even their lunch. All this will weaken our qi and make the qi stagnate easily. There are, of course, the chronic disease, people who already suffer from long chronic high blood pressure or heart disease, some liver problems or thyroid problems, people who are already on a long-term use of medications. All this medication also consumes a lot of energy from us. And not to mention that many people that nowadays, they don't really sleep well. So if we know that we have a qi disease, then how could we treat our qi disease? Because the doctors could not really sell us qi. If we have a qi deficiency, no doctors in this world, not even Lily, not even I, we could not really sell the energy to the patients. There is no pharmacy who could sell or who could provide qi to the patients. To understand this, I would also like make a very quick development of how the qi disease could develop. So all we say that diseases, they start with qi stagnation. So if qi stagnates, later on it could stagnate with our body fluids. So if it stagnates with our own body fluids, with our own water in the body, we may have some nodules, we may develop some cysts, some fibroids, and at this stage, even that it could be seen from the conventional medicine, the doctors will still tell us, oh, you're still healthy, it's okay, you don't have any problem. But then we know this qi stagnation, and with this cyst fibroid, it will further clumps with phlegm, with some blood, with our own blood stasis, and then we will have even more nodules, some bigger nodules, more nodules in the body, or even edema in the body. And these cold nodules, they are still harmless. Well, at least many doctors, they tell the patient that, yeah, you have some cold nodules in your thyroids, but it's okay, let's just observe. But suddenly you will notice with an immune system weakness, with some low basal temperature, we say there was some emotional poisoning, some emotional stress, or even some oxygen deficiency, namely too little sport or too little physical activity. These cold nodules could become suddenly hot nodules. And then the hot nodules at some points, with all the crisis, with a crisis in our life, maybe a very heavy COVID or a very heavy infection, or some events, a breakup with our partner, or etc., etc. It could suddenly become uncontrollable cancer. And then the doctor say, oh yes, now we have to do something. But as you can see, if we go to the last stage, to the stage that it's already manifested and we have to take medication, it's already getting more and more complicated. So if I always tell my patients, if you got some complaint, you could ask some questions. Why I'm having the problem now? Why, for example, everyone living in the same roof, so many people, that some people will get infections, some people not, and why some people they healthy, and why I'm getting it now, and why I'm getting the problems with my lung, with my breast, with my thyroid. So if we can understand better our own visible part and invisible part, our emotions, our energy, that it might help us to live better, at least if we don't have any disease. Luckily, we may prevent the further disease with let's say medical Qigong, or if we already have some disease, at least we will get our life quality, or we will support our health more better through the medical Qigong. So we say if Qi is ill, of course we have to apply medical Qigong to heal disease. So I will go to the next slide. I will also want to give you example of what I'm talking about Qi weakness, and make it very concretely to the kidney Qi weakness, because I'm really seeing it every day in my practice. I'm sure Lily as well. She must also see. We have some discussion together, and we both agree that nowadays in the clinical practice, there are many patients coming and they have this kidney Qi weakness, and they themselves, of course, they're not aware of it even themselves. So what are the symptoms for a kidney Qi weakness patient? They might have, for example, cold hands, cold feet, that they, if you ask them, that they will say their hands, feet, they're never warm, and they will put on very thick pullover, and they freeze easily, and they have some edema in their face or in their legs, because the kidney Qi is responsible to give us the warmth, and it's also responsible to transform the water. So the second biggest function about kidney Qi is the kidney Qi is our essence. It nourishes our brains. So this meridian goes from the feet all the way from the legs, and then go to our fertility organs, and from the fertility organs from our back all the way up to the breast, nourish also the heart, and then goes up to our brain and nourish the whole brain. So imagine if the kidney Qi is not sufficient, people will suffer from hair loss. They will suffer from the ringing in their ears, and they might also have some hormones disorder, because the kidney is also responsible for all these hormones produced in our body. And they may also have more the fatigue, but the fatigue, instead of like physical fatigue, is more about mental fatigue. It's about concentration problems. Particularly some young people, they could suffer from concentration problems. I have some patients now complaining that after COVID, they have some difficulty even reading books for a long time. They may read, they will still read, but then they find it's more difficult now to read more than half an hour. And they also find that after just a very short time, they couldn't really concentrate very well, because the brain now is not well supported by the kidney Qi. And for children who develop the bed wetness, even for example after sex, I have children even after 6, 7, they may still need to wear the Pampers, because they will have the bed wetness. And they have some old people or young people, they have memory problems, and all the mental problems like Alzheimer, dementia, or the dizziness, they could all be related to the kidney Qi who is not sufficient enough to nourish our brain. And kidney Qi is also a big function, or it's another physiology in the TCM. Is kidney Qi also works together with the bladder. So kidney and bladder, they are a partner who works very closely together. So all the problems related to the bladder or the urination, it's also related to the kidney Qi. Let's say the frequent urination after drinking water, every half an hour they have to pee, and particularly they have to pee a lot at night. They have to get up every night more than once to pee. And women who, for example, after their delivery, after birth, they will feel peeing when they laugh. So all this, they are related to the kidney qi weakness. Another weakness, for example, is in the fertility disorder, because kidney qi goes directly into our fertility organs. So for women who have irregular periods, or who can't, who try to have a child but unsuccessful in having children, or for example for men who had impotence, this fertility disorder is all related to kidney qi. So for example, very typical complaint that people complain that they have no libido, and they don't get, women don't who have difficulty getting pregnant, or even with IVF, many women that they still have difficulty in getting pregnant. And for people who easily suffer from miscarriage, it's also we also have to strengthen the kidney very often in our TCM practice. So let's move to the next part. The kidney qi is also responsible for all our bones, namely, for example, our teeth. If we have problem with the teeth development, if we have problem with the marrow, or we have some shrinking jaws, some bone problems, then it's also related to kidney qi. Very often I have one of the pain in the practice is about the back pain, particularly lower back pain. So for the lower back pain, or we say the knee pain, these are the major area that the kidney channels run through. So if the kidney is weak, of course, people will develop very easily back pain, knee pain, lower back pain, or altogether with some other problems with their brain. And interestingly, in TCM, we also say kidney gives us these hormones. The hormones is the essence of our life. So if we have some hormonal problem, the hormone disorder in the fertility, or for example in the thyroids, in the glandular function, the thyroid gland, the thymus gland, the pancreas, the adrenal glands, all these glands who produce important hormones for the body. If we have problems like a lot of autoimmune problems, that we also have to go back to our kidney and support our kidney. And a very interesting aspect, in my opinion, or in the TCM treatment, that kidney is related to anxiety and stress, and particularly the direct emotion, because every organs in TCM has its own emotions, its own, for example, we say the kidney related to fear, the spleen is related to overthinking, and lung is related to the sadness. So kidney is very much related, for example, our anxiety, our stress. This is very important for the patient to know in their daily life, because if we know the kidney produces anxiety and fear, so if we have a weak kidney, then we will experience more anxiety and more fear. And in another way around, the anxiety and stress, they even make our kidney more problematic, even weaker. So this is like a vicious cycle. We have a weak kidney, and then we tend to develop more anxiety and stress. But if we have more stress and anxiety and fear, our kidney will become even weaker and worse. So what are the people normally look like if people have kidney Qi deficiency. People could really get, they will say, oh, I always have some fear, some anxiety about the future that I don't, I can't plan. Or people who are very timid, people who feel anxious all the time, even though that they couldn't even explain why they're anxious. And these people, they also tend to be perfectionists because perfectionists, if people want to be perfect to get recognition, then there must be also some fear behind, some really deep fear that they couldn't get the recognition. They are not recognized in the society. And this big fear will drive them to make everything perfect. But making everything perfect also weakens our kidney. So this is like a little dog chasing its own tail, or people who just hunt themselves. This is like one example to give you an idea about what we're talking about, like kidney qi weakness. There are also like lung qi weakness. We have another function because lung in the Chinese medicine is more related to qi production and also to the qi distribution and also qi downwards direction. So people who have very soft voice, or who feel very tired after speaking for a long time, or who have very low voice, or people who get easily cough, or who get easily tired and getting sick very easily, get infections all the time, then this has something to do with the lung qi weakness. So as you can see, the lung qi deficiency people, that they don't have very good skin usually, because the lung in the TCM, they nourish our skin, and the low voice, and like the lung opens our nose, so all the problems with relating to our nose, let's say the hay fever or the blocked nose or the throat problems as well, they are the organs that are related to lung qi, or the lung. So if you have an idea of what I'm talking about, qi disease in general, and also in different organ functions, then it's not difficult for me to explain why we need the medical Qigong, because medical Qigong, it's parallel to all of the other 5 treatment. We have like 5 pillars, no, in TCM. This including acupuncture, so the second, like the herbal tea, and like Tui Na is the massage, or we talk about the moxa, moxibustion, the warm therapy, and Qigong is the 5th. So so this is working very similarly. Actually, the basis for medical Qigong and acupuncture, they are completely the same. The TCM theory are the same, only that Qigong is like the only form actually that doesn't need any external tools. We don't need needles, and we don't need like herbs. We have to work with our own energy. So it's like the movements and breathing exercises, combining all these two to activate our channels, our meridians. So if you don't know anything about Chinese, then I explain a little bit Qi. Qi, as we talk so long now, till now, is the energy of our life, energy of our body. And Gong, like Qi Gong, Gong is practice. So literally, Qi Gong, it just means energy practice. The purpose of the medical Qigong is to bring our Qi back into balance, because we might have disbalance in the different organs in our different Qi systems. And I would like to give you some classification of different medical Qigong form or different Qigong form, because many of you must have heard of Qigong already. But in the medical terms, we have to distinguish the medical Qigong from other form. Medical Qigong belongs to the basic level. So basic level doesn't mean that it's the lowest level. Basic level just means that the purpose is really to heal disease. It's very very specific for people who have Qi disease. For example, we will talk about a medical Qigong form this evening, really to address many indications in our daily practice for many of you. And there are, for example, even a quite well-recognized Guolin Qigong. And this form, for example, is specifically for cancer patients. And it's been working very effectively in many hospitals in China. And many hospitals in China, they have even a medical Qigong department giving the exercise to the patients themselves so that they could practice it on a daily basis. The second level is called the medium level. This medium level is what most of you know. For example, Tai Chi or Ba Duan Jin, the 8 brocard, and even yoga also belongs to the medium level. So this medium level, including even some, in Germany, we have like autogenic training. So it's like a training to help us to relax. But this Qigong form, they belong to the medium level who are not specifically for the disease. They are, I always tell my patient, if you practice yoga, it's fine. But if you want to support your disease, then you have to do the medical Qigong, because the well-being and balance, you could put the medical Qigong into the drawer again once you don't have any problems. But yoga doesn't help, for example, the allergy, or doesn't help the kidney Qi deficiency so effectively as the medical Qigong. And there are also the third level, what we call the upper level. There are many Qigong masters in China. They really do the Qigong on the daily basis for more than 10 hours per day. And they want to achieve some spiritual perfection, and they want to develop certain special ability. This is not the level that we want to talk about. And so moving to the next slide, I want to introduce to you what I am giving my patients since like almost more than 2 years, and it's working very well. This is called Xianggong, Fragrance Qigong, literally. It's medical Qigong form, and this Qigong form, it's very easy to learn. And the reason that I recommend it to my patient, because I have even children who develop asthma, who develop allergy, and my youngest student, it's only 5 years old. So this is very easy to learn. I would say, well, my oldest patient who practice this Qigong form is already 82. So I put it here from age 5 to 90. So it's easy to learn, very practical. And this also a medical Qigong who are very well researched. In China, they have a specific department. It's official Qigong department belonging to the ministry, the health ministry in China, and they have to prove, they have to really check many different Qigongs, because in China in the 1980s, many Qigong masters, they claimed that their Qigong form could heal disease. So that's why the health department established a specific department to examine the different Qigong forms. So only the Qigong form who could go through all these checks, including 3,000 patients in the hospital, showing effects, showing a very effective improvement, to be categorized into the medical Qigong category. And this Shanggong belongs to the form, so it's very well researched. Even in Germany, the Charity hospital is one of the biggest and also international hospital in Berlin. The Charité hospital has some pilot study on this medical Qigong, and they find clinically it helps some children. They do this pilot study on different schools, and it's a very good, they have very good results from it. And this form, I'm also quite, I'm also think in my patient, they will give me the feedback that it actually worked quite quickly. So it's really working even similar to the acupuncture. In the acupuncture, the patients, they feel it immediately after the needle setting in, and patients who feel the effect quickly, even from the first day, after the first session, or after the first few movement. And also we will see it in the later slide. The medical Qigong from this Shanggong form, the indications are quite wide. It's not only migraine, it's not only, for example, here, I just list some major complaints from my patients. I had really very good result for migraine patient, allergy patient, pain, endometriosis. So these are really the, in my daily clinics that are working very well. And I always explain also to my patient why it's working so well, because it actually working very similar to acupuncture treatment. It acts on our meridians and our channels. It works on our energy, our qi, and many acupuncture points. But even more in a holistic point of view, because imagine that I'm sure Lily, like me, we couldn't really needle our patient like a hedgehog. We might put in maybe 10 needles or 12 needles, but we couldn't really put every meridian 1 needles or 2 needles on it. That would be too many needles for the patients. And for patients who, for example, who just visit the practice every week or every 2 weeks, then it's the treatment, it's will just go forward very slowly. But if they have the medical Qigong form at home, they do it every day, they activate their whole meridians on a daily basis, it will definitely accelerate the acupuncture treatment, the herbal treatment. It will also accelerate the healing process of the body. So this, for example, that I find, one is in German. So because I'm working in Germany, it's you could even find that Qigong for school children that they do. So it's very well documented. It's also well researched in Germany about the medical Qigong. And actually, here in Germany, there are many centers in the hospitals that they also give patients a medical Qigong to recover from many different chronic disease. I've listed some indications about the fragrance Qigong could help. Well, as I say, to be able to fill the different criterions to be a medical Qigong, they have to be researched in hospitals with more than 3,000 patients. So this Qigong form is already done and it's already proved in Chinese hospitals, and they do it with more than 3,000 patients. And I found some of the indications that that are published. For example, in my own practice, I think that the allergy, hay fever, or asthma now, for example, long COVID, or the skin problems are working quite well. The patients showing a very good results with allergy or the skin problems or hay fever. And another is, for example, it's not like organ heart problems. It's more like functional heart problems. Let's say certain slow heart pulse, or some high blood pressure, or even low blood pressure. The patients, some patients will check their blood pressure before the practice, and after the practice, their blood pressure, it's immediately already lower. So, so some long COVID symptoms like the fatigues or some headaches, it's also quite a good application from Frednan's Qigong. One of my favorite recommendation to the patient is patient with sleep disorders. So people complaining that they don't sleep well, and if they do this Qigong form, only, for example, only the basic level for like 20 minutes before they are asleep, they will be able to sleep much better. They fall asleep much more easier, and they also sleep through better. So what I found under this nervous and mental system is sleep disorder, migraine, or I give it to 2 multiple sclerosis patients, and they also give me very positive feedback. I work with a few epilepsy patients, and also it's showing improvement. Another very good area, it's about the gynecological disease, like the period pain, endometriosis, some cysts or infertility. These are the areas that I also accumulated experiences. In the immune system, my patients practicing it, for example, the Hashimoto, the thyroid problem, that the autoimmune system. In terms of the pain problems, for example, the cervical spine problems, the neck, shoulder, if it's really more related to the tension, the muscle tensions, and for example, we talk about the kidney Qi deficiency will cause back pain and knee pain. And the Frednan Qigong, they strengthen the kidney, and of course, when the kidney is strengthened, all the problems related to the kidney will be improved. That's why it's not surprising now we see here renal bladder system, because this Qigong form strengthens in general the heart, the lung, the kidney, and for the liver there are another form, but in general for the kidney, heart, and lung are very good for this pregnancy Qigong form. That's why you see here with the weak kidney, not only like organic kidney problems, but also kidney deficiency, kidney energy deficiency. Or for men, for example, now with the age that my prostate enlargement, incontinence, frequent cystitis, because bladder, kidney, as I said before, they're working closely with each other. So these are few books that in Chinese that I find it in China that they have a lot of different research on. And I will also briefly give you an idea of the Qigong teachers of Lily, and also my teacher, like Miss Lee Helwig. So she's working in Germany. So here, so she was the vice chairman of the World Medical Qigong Association. It's the biggest official Qigong association worldwide. The headquarters is in Beijing, in the capital of China. And my teacher, Miss Lee, she studied both conventional medicine and also Chinese medicine. So with her profound knowledge in conventional medicine as well as Chinese medicine, she's able to work very well in a very good hospital before she came to Berlin. So she used to direct a Chinese medicine center in Potsdam in Germany. And she has worked more than 30 years with Qigong and Chinese medicine. She is now, well, almost 80. And even the picture here that you see, it's taken when she's over 65. So it's a lady who practiced Qigong herself for a very long time, and who also worked very well with cancer patients. So she later on, in the later 20 years, she focused really on giving medical Qigong to cancer patients in Germany. And she also herself, she trained many Qigong teachers and many TCM practitioners in Germany. So my another teacher, that's the Professor Tianjun Liu. Professor Liu, it's quite well known in China, because he's like one of the major professors for medical Qigong. And if you can check in online, there are many different medical Qigong books written also in English, and they are translated from Professor Tianjun Liu. So if you know Chinese, if you can read Chinese, you could even find books, textbooks in the TCM universities that they were written and edited by Professor Tianjun Liu. So and he used to be also the president of the International Academic Medical Qigong Society, like my teacher, Miss Lee, in Beijing. So I've also learned a few from other practitioners here in Berlin, including Liu Yafei, who is quite famous and who runs a medical Qigong hospital in Beidaihe in China. To give you some concrete feedbacks, what I'm hearing from my patients, they normally tell them, even from the first day, some young patients and even some other patients, in general, they immediately feel from the first week on, they could sleep better. They feel that they have more energy, and in the morning they could get up more easily. They could get their life, they could get their work more easily. A long day is not a problem anymore. And for patients who have complaints, so you might be interested in, that's more important, like patients with hay fever, with allergy, or with some stomach issue, stomach pain, or some headache, they will see they complain much less often, and they will also feel they have in the allergy season, it's working even as good as the acupuncture, for example. I have patients who practice the medical Qigong even when they start to feel the headache, because if they have migraine, they might not be able to come immediately to my practice to get acupuncture. But then as long as they start practicing the Qigong at home by themselves, it's working amazingly, even like some painkillers. My patients sometimes call the medical Qigong painkiller. But I mean, it's much better than painkiller because the Qigong doesn't really give us any side effect as the painkiller or any medications. So people in general, the patient feel in general, they are more relaxed. They're not as, they don't get irritated as easier as before. People who complain that they have a lot of syndromes when it's full moon, when it's before periods, they could deal with everyday stress, everyday emotions much more better. And what I think it's also good is patients had also more self-confidence. They could trust their own body better, and they also develop better connection with their own energy, because some patients will say, now I finally know what is good for me and what is not good for me, and I have a better connection between my body and mind. So they could say stop easily to themselves. They will be able to set their own limits more easily. And it's interestingly, because if you have more energy, you also will feel your own problems more easily before you are getting sick. So people typically will say, oh, I know that now, I know that even I could feel myself, I have now a kidney Qi deficiency. Now I have to do something. And then they prevent themselves from getting sick. So, and I mean that for me, it's not difficult to convince the patients, because patients who practice medical Qigong, they eventually will know it's a very good investment for themselves, because it saves not only the money that they need to spend in medication, visiting different doctors, and it also saves really a lot of time in everyday life. If they could have a better concentration. Remember, if we have better kidney Qi, of course we will have a better brain, and we will be able to concentrate much more better, and then we will be able to get up more quickly. We will learn things. We will work more efficiently, and we will also recover more quickly after an infection. And we will also have a field visit to the GPs, to the doctors, and all this, they save a lot of time in our daily life. And for me, I am also working then together with my patient. As a therapist, if my patients are very active in managing their own health, it will make a great difference in the whole process. So patients who practice medical Qigong will need fewer acupuncture sessions. So with the normal, even with the acupuncture sessions, they will make the progress also more quickly. So that's why I'm really happy if patients practice Qigong, and then we working as a team together. As therapists, for example, Lily practices medical Qigong herself, and me too, because as a therapist, we're working every day with the patient, and we also have to be aware of our patient, what their energies are, what their emotions, what their feelings, and all this will need much energy. I would always say, well, although as a therapist, I'm not selling Qi, I'm not selling energy to my patients, but of course, I am giving some impulse. I'm trying to support my patient, and supporting my patient, of course, I need to be healthy and strong myself. And my teacher, Miss Lee, said the same thing. As therapists, we practice medical Qigong, and we could keep our goods balance. If we have a good balance, we will be able to help the patients much better. So I already told you many things. What can you benefit from Qigong? It's a good support in the TCM treatment, and everyone can actively practice Qigong. It's the only form that we have to do by ourselves, because, for example, you need someone to needle you. You need someone to prescribe the herbal formulas for you. You need someone to do the massage for you. But Qigong is the only form that you have to do it yourself. It's the proactive attitude, and it's also what I always tell patients: you have been suffering from the disease for many years, and investing the time is not only that you are doing for your health, but it's also that you're putting some focus on your own body. You listen to your own body. You're trying to understand your body, and with Qigong, it helps the patients to be aware of themselves, and also to be more confident about themselves, because they will notice the difference, they will notice the benefit, and it will make them more confident. And this confidence is very important in the healing process. And it will also save, as I said, not say a lot of time visiting from doctor to doctor, therapist to therapist, and it's something that helps us to prevent the future disease. The last few slides, I would like to remind you very kindly, it's very important that, for example, that you learn medical Qigong from a qualified therapist with TCM knowledge and experiences. I know that many patients, they tell me that they will just find some YouTube videos before, because I practice TCM now almost 10 years since I treated my patient. And at the beginning, I didn't want to actually teach the patient, because I have been very busy. And I would tell patients that, please, maybe you could try to learn from other teachers, or maybe you could learn the medical Qigong. And some of them will find some YouTube videos. They find YouTube videos, and then it's not really working properly. And even some of them have some side effects. So that's why I realized it. And I started to give them courses since 2 years, because I realized only when I share my knowledge and my experience, that I could guarantee that the patient benefit from the medical Qigong. So please, because if you don't practice properly, there are really side effects. And Lily, for example, as a qualified TCM practitioner, and also she has very profound TCM knowledge, and she has, more importantly, she has very good knowledge about you as patient. It's very important that the teacher knows the patients, know the constitutional weakness from the patients, so she could adjust some movement, because everybody may slightly need different movement. And a good teacher, a good Qigong teacher or therapist could adjust the different exercises according to the patient's need. So that's why it's important what I found now, my conclusion about my past experience is the patient needs to change their mindset. They have to be proactive, and they have to have the attitude, I want to do something for myself. I want to do something for my own health, and I could do it. And the second factor is, of course, you have to invest the time. For medical Qigong, it's really important to do it every day. Some chronic patients will even do it twice a day, or really chronic like epilepsy, my epilepsy patients, or my after stroke patient, they even do it 3 times a day to benefit from the effect of medical Qigong. And the exercise quality, of course, is very important. That's why I emphasize again, learn it from a qualified therapist, because a qualified therapist could correct your movement and could also check and control your exercise quality. Only with a good quality exercising, we could achieve the benefits. So I think I will move to the next slide to give you some details. The courses detail the same with Lily and with me. So in Germany, normally I will just give 8 appointments to learn medical Qigong. Generally, each appointment will be 1.5 hours to 2 hours, depending on how big the class is. For example, if the class only 6 people group, then I will do it in 1.5 hours each session. But if it's more than 10 people, of course, I need longer time to correct the people in the group. So it will be then 2 hours. My current course, I will do it 3 presence appointment and 5 online via Zoom. And in the content, normally I will give the exercise to my patient. I will let them to exchange their experience exercising it, and I will also educate them at each session about some TCM basic knowledges. Just like, for example, I just introduced you the kidney Qi deficiency. I also introduced in my appointment to my patient what are, for example, spleen Qi deficiency, and why some patients they are having different syndromes. So the patients will have another perspective on their own body, so that they also know how their body functions from the TCM perspective, and why, for example, the medical Qigong, every movement is working for specific problems. The online meetings, the online Zoom exercise is also quite helpful in my opinion, because it will save some time from the people don't really need to come each appointment to the practice, and the patient could look at the videos. I mean, these are the videos that given by qualified therapists with your own movements. So you will be able to learn it again and again to repeat the exercise. And I also give quite a lot of support through email, through e-videos. Some students send me their videos, and I sometimes organize a group practice per Zoom, or sometimes in summer when good weather that we practice together in park. So this are my plan. For example, the 8 different appointment. My next course starts end of February. The presence appointment is in the school where also I teach TCM. And the other appointment, they're online. And I also want to show you that Lily's course. So for patients, those patients of Lily, you might look at the course plan, and I think that Lily will be happy to answer your questions regarding how to register and what to expect, or any questions that you might have regarding the course appointment. So the organizations is similar. You will have like about 2 hours in the evening, 3 presence appointment, and she will guide you through all the exercise, the ground level and intermediate level. She will correct your movement. She will also explain how each movement should be done, etc. So I think that I've already taken enough time from you, but I still want to share like one sentence that my teacher, the Miss Lee, always tell us, and I think it's quite appreciated from myself and Lily, and also many of my patients who heard that. She said, God give us the face, some beautiful face, maybe some not so beautiful face, but God give us the face, but we have to love by ourselves. And I hope all of you could enjoy a genuine smile on your face. All right. Okay, so that's my presentation for this evening. I would now like to give some time to Lily if she would like to say something, or I'm happy now to answer any questions that the audience will have. As I said, we record this video in case you don't want to show up your face. You could you could just shut down the camera, but if you don't mind, you could also turn on your camera. I'm very happy to see your face and to answer your questions. Please.
Okay. Okay, thank you very much. Oh, I was watching. So everyone need any want asking any questions for Teacher Lee? You are free to asking, and you can open your the voice now. So Erica Johnson raised her hand. So
hi, Dr. Lee. Thank you. Am I muted? Okay, no, I'm good. Thank you for the presentation. This was really interesting. I was wondering if in the practice of Qigong, medical Qigong, if you focus on one specific, for instance, you focus on the lungs at one time when going through this course, do you only focus on moving the Qi surrounding specific organs that you covered, or is it a holistic approach?
Well, that's a good question, because the medical Qigong, as there are really many different forms. No? So the medical Qigong that I'm teaching, or Lily is teaching, it's had very bright, very wide indications. That's why we are not specifically just doing the lung Qi support, for example. In this Qigong form, it will activate the lung meridian, it will activate also the heart and also the pericards, closely supporting the lung as well. So in TCM, we say that you have some lung deficiency, but you still need the support from, for example, kidney. You also need the support from heart, because they have an impact on the lungs. So from the holistic point of view, it makes sense that actually you need a Qigong form who activates as many channels as possible. And this fragrance Qigong meets the expectations. So you will learn the movement, and this movement, they will activate the lung meridian, the heart meridian, and basically all the 12 meridians that in the TCM. So we're talking about the major meridians. Of course, there are focus. For example, in the beginner level, that there will be more focus on the lung and the heart. But so that's why the movement will be more concentrated on the upper part of the body, because that's where our lungs, our hearts are. But in the intermediate level, that the focus will be more on the kidney, the liver, and the spleen. There will be more movement with the hip, with the lower back. So these are the activations more for the channels in the lower part of the body. So basically, if you practice a normal practice, for example, Lily practice this medical Qigong every day, and she do it from the beginner level to the intermediate level. It will take roughly 4 quarters, so 45 minutes. If you do it 45 minutes, you activate already the whole meridian.
Okay. Okay, great. And is the program in Berlin going to be in English?
Yes. Well, I have 2 courses, one in German and one in English. So if you're interested in joining the English class, you just write to me.
Okay. Thank you.
You're welcome. So anyone else who?
Because you already said very clearly, maybe. Oh, Martin, you want to? You can unmuting your. You can unmuting your. Hello, Martin. You can. Yes. You
Well,
can.
I can't hear you.
Mute. Okay. I don't know how to. Wait.
You're the monitor. You can go to. I think that you could just
Ask to
unmute. You just go
so Martin, you haven't. Yeah. We can. Okay. You can. Yeah. You can say now. Oh, still no.
No sound.
No sound. Why we can't hear you, Martin? Can't hear. Yeah, it seems don't know. So anybody else can say, can we hear you? I think anyone have questions?
I don't have a question, Dr. Lily, but I just wanted to say thank you, Huating. That was really interesting and really informative. Thank you. I think that's why I've got no questions, because you covered so much.
Yeah, very clear.
Yeah, it was. Yeah, so thank you.
Huating's English very good, very professional.
Yeah.
Yeah.
Thank you.
Okay, if anyone no questions, I think Huating, you need to you're very busy. You need to prepare. You have young children. You need to prepare to.
Well, that's fine.
Yeah.
Well, you know that now we are like an hour earlier than you. That's why you are now 9 o'clock, so I'm 10 o'clock.
You're 10
so
o'clock
that's
already.
Roughly the time that I need to start practicing my medical Qigong.
Yeah, okay. Yes, me too. I needed to do mine. Okay. So in that case, that's all for today. And thank you very much. Trishi, do you want any questions? You need to, oh, you haven't opened your voice.
I think that they have to unmute. They have to unmute the.
I don't know how to.
Yeah.
Yes, are you okay? Do you have any questions? Oh yeah, why we can't hear? Yeah.
Well, maybe they could. I mean, that if people we couldn't hear them, they could write their questions in the chat. Then I could.
Yeah, they can.
I could see the questions in the chat, and I will answer them.
But we can hear Daniel. But why they can't? We don't know.
I know I use Zoom quite a lot for work, teleconferences, Dr. Lily, and I had to tweak. I had to mess about with my settings for a little bit. Yeah.
Oh yeah, you're good at it. Okay. Anyway, if anybody wants to learning this or to asking questions, please contact me. You know my number, and also is people in Germany can contact with Huating Li. Okay. Okay. Thank you. Goodbye.
Thank you.
Thank you very much for Huating. Thank you.
You're welcome.
you.
So,
Thank you,
I
thank
mean
you.
that if in case anyone had question, you could always ask Lily, and she will transfer the questions to me, and then I will just be very happy to answer your questions. So we are very good colleagues, and we are also working closely together with TCMs and with medical Qigong. So I'm happy to support Lily.
Okay,
And
thank you very much. Thank you. Okay, thank you for
Thank
joining
you.
this lecture. Thank you.
You're
Bye-bye.
welcome. I wish you a good evening, and
You too. Thank you
Bye.
very much.
Bye now.
Bye-bye. Bye-bye.
bye-bye.
Bye.